All right, Cam, welcome to the show.
Awesome to be here with you, brother.
I appreciate you jumping on. So, a lot to get into, a lot to talk about. For people that don't know who you are, have never heard of Maximus, and have never seen your face, tell people what you do, what you're striving to do, and then we can go in from there.
Absolutely. So I'm Dr. Cam Sepah. I'm a healthcare practitioner by training. So I'm a licensed clinical psychologist and clinical professor of psychiatry at UCSF Medical School. So, I come from the background of being a clinician that treats patients and a scientist that publishes research papers. But about a decade ago, I transitioned to becoming a health tech entrepreneur. So I helped start a company called Omada Health, which is one of the largest digital therapeutics companies in the world that helps people lose weight and avoid diabetes. And now I am the CEO of Maximus, which is a consumer telemedicine company that helps men optimize their testosterone and their performance.
That's awesome. So let's talk about Maximus because I think a lot of our listeners would love to double down on that. What is Maximus? Why did you start it? I know you have some pretty famous investors, public investors that invested into Maximus. Why did they invest into this, and kind of what's the overall picture with the company that you want to get to?
Yeah, absolutely. It's a great question. So, my background and training is actually kind of in mind body medicine. I have a fellowship training in behavioral medicine. So I'd study really $10 words like psychoneuroimmunology, psychoneuroendocrinology, which are just fancy ways of saying how does the mind influence the immune system, or how does the mind influence the endocrine system in terms of hormones. And I was always
Mm.
really interested in the interplay between mind and body. Like back in college, I even got to do some really cool research with Tibetan Buddhist monks that were from the Dalai Lama in understanding things like the physical benefits of meditation and the cognitive benefits of mindfulness meditation. And it really kind of opened my eyes to a really interesting point, which is here in the West, we have this mind body dualism, right? We consider psychology and medicine separate. The mind and body are separate. Even back in the 80s, we never believed that like your emotions can influence your immune function. Even though anecdotally, we know that when people are stressed, they're more likely to get sick. I actually wrote my entire doctoral dissertation on the fact that positive emotions can be immuno-enhancing and actually protect our immune system. And so, similarly, as I kind of got further along in my career, I became really interested in the hormone side of things because I ran across a fascinating statistic that I didn't even believe when I heard it, which is that testosterone levels and sperm count have gone down over 50% in the last 50 years. And it's such a drastic decline. They were saying, well, if this trend happens to continue, and God forbid that it doesn't, we'll basically hit sperm count zero in the year 2040 and not be able to reproduce as a species. Now, I don't think that's necessarily going to happen, but the decline is so drastic that it's having actually
Mm.
pretty profound impacts on our society. And I'll give you some really interesting examples. So, one, there's a fertility issue, right? So, when sperm counts are half as much, especially with men and women having children into their 30s and older age, it's very common if you just ask amongst your friends how common fertility issues are and how often things like IVF, in which you have to do a technological intervention in order to have children, is becoming more and more common these days. And it's not the woman's fault half the time. It's actually men that are responsible for the infertility issues. So that's obviously a huge crisis in terms of our society. Our species literally and culture, relies on successful and healthy reproduction. So that's one thing. And then the other thing that I started noticing too, obviously as a psychologist, is there's been a huge decline in masculinity. So they've done surveys of folks of different age ranges. And if you ask guys that are over the age of 65, right, people are kind of in our father's generation, how masculine are they on sort of like, a 0 to 6 scale, and consider
Right.
5 or 6 highly masculine.
Right.
82% of guys over 65 consider themselves highly masculine. Now, if you ask guys under the age of 30, uh, it's less than 50%. So basically, in the span of one generation, masculinity has kind of gone out of favor. Guys don't even see themselves as masculine anymore. Now, why
They
is
just feel like they don't feel masculine. That
exactly?
people, kids in their 20s and teens, but they don't feel like. How do they feel?
So, yeah, in terms of the spectrum of masculinity and femininity, they probably feel somewhere more in the middle.
Mm.
And it's probably a complex reason for that. That's biopsycho and social. I think biologically, one of the big drivers of that is the decreased testosterone, right? If you are, testosterone is sort of the master male hormone. It is the masculinizing hormone, right?
Mm-hmm.
In utero, we don't have a gender, and it's the influx of hormones that literally determine, which gender we sort of develop. And so if you're not exposed to testosterone, literally when you're in your mother's womb, you become less masculine. And there's these really, really interesting findings that show that. So for instance, like literally testicular weight, the weight of your testes, has gone down when they measure it in babies over the span of decades. And even physiological markers of masculinity, which is like, for instance, the distance between the length of the perineum, which is the distance sort of between your testicles and your anus, which is one of the key hallmarks of a difference between men and women, has been shrinking over time. So this is not just a psychological phenomenon, it's a physiological phenomenon. But obviously, when you have less of that masculinizing hormone, you probably feel less masculine as well. There's obviously probably psychological and social constructs that are at play here too, right? There's this huge notion of toxic masculinity that Gillette and the APA have propagandized that probably makes masculinity a dirty word. So I'm sure maybe some guys don't want to associate it or think masculinity.
Well, can I stop you real quick? Just because I don't want to. There's a lot to unpack, and I feel like we're gonna have to go through like 30 different things after you're done talking. So with men developing less testosterone, how much does the diet of the man and women play a role in that? Like, how does lifestyle, right? Like, if you're a healthy adult and you go to the gym and you eat perfect, obviously your sperm quality is theoretically supposed to be higher. And then let's say the female is eating healthy, doesn't smoke, doesn't do drugs, doesn't drink alcohol, very healthy, meditates, stress for like low stress.
Right.
How much does that play a role into the development of the child? And then, into adolescent and then into adulthood. And then the next question would be, what's like the origin story of decreased testosterone? Is it food? Is it air quality? What is it?
Yeah, it's a great question. So you're bringing up this notion of what's the impact of lifestyle factors on testosterone and perhaps the decrease that we've seen. So it's a great question. This is one of the first things that scientists tried to investigate when they saw this generational decline in testosterone. By the way, it's so drastic that the difference between basically your testosterone, let's say at the age of 30 versus your father's testosterone at the age of 30, he had probably twice as much testosterone than you did at the same age, right? And so Forbes wrote this great article about it. It's called "You're Not the Man Your Father Was," which is kind of like a stab in the heart if you kind of feel about it. Because I don't know, physiologically and maybe even psychologically in how you perceive yourself, you're not quite the same. So the question is why? And they looked at lifestyle factors. One of the biggest lifestyle factors is obesity, right? There's been a huge change even in that one generational span in terms of obesity. 70% of Americans are overweight or obese. 88% of Americans have a metabolic dysregulation, meaning high blood sugar, high blood pressure, high cholesterol, and dyslipidemia. These factors are contributing to the decline in testosterone because the more body fat that you carry, the more aromatase enzyme that you carry. And aromatase is basically the enzyme that converts testosterone to estrogen. So it literally makes you less masculine, more feminine.
Are these people that, let's say they have type 2 diabetes or they're overweight, are you saying that because you cause yourself to be type 2 diabetic or you cause yourself to be obese, now you have a direct correlation with low testosterone? Or this is the people that have type 2 diabetes that are breeding, now their offspring is going to be predisposed to lower testosterone because you are, let's just say, obese or overweight, and now you're mating with someone, you're carrying those genes off to your offspring, or both?
Yeah, it's a good question. So there's a little bit of a misunderstanding about diabetes. So type 1 diabetes, which is used to be called juvenile diabetes, much more genetic. You basically have a pancreatic dysfunction. You're not able to produce insulin. These folks inject insulin even from a very early age. Most of the diabetes, however, that we have in our society is what's called type 2 diabetes. And even if there's a genetic predisposition, for instance, certain ethnic groups have a higher predisposition to type 2 diabetes, we even find that those ethnic groups, when they come to the United States, have much higher rates of diabetes. So that suggests that even with the predisposition, it's mostly a lifestyle disease, right? And we know this also because of all the work that I did at Omada in that lifestyle intervention. When you get people to lose 5 to 10% of their body weight, it dramatically reduces or if you will, reverses the risk of diabetes. So it's largely a lifestyle thing because our genetics haven't really changed in 50 years, right? It's mostly lifestyle, and the rate of obesity and diabetes, or what's now called diabesity because it kind of goes hand in hand, has dramatically changed over the course of literally one generation, which is primarily driven by ultra processed food, as you brought up. So diet plays obviously a huge role. And obviously the less whole food that you're eating, the more ultra processed food. 66% of American calories now come from ultra processed food, which is stuff that you really can't make at home. It's like a Cheeto, for instance, that can only be made in a factory. Food scientists have optimized it so that it's, dispersing calories and amazing taste, but doesn't have much nutritional benefits. So that's it's a huge factor. There are some other lifestyle factors that are driving the decrease in testosterone. For instance, smoking, depression can drive these things. But here's the interesting thing. When they try to statistically control for these factors, even though they know, for instance, obesity is one of the major drivers, even when you control for it, meaning that you correct essentially the analysis to say, let's assume everyone was the same way, you're still seeing a decline in testosterone. So the researchers are like, okay, what else is driving it if it's not lifestyle? And one of the hypotheses is endocrine disrupting chemicals. There's a lot of chemicals that come in our food. So it's not just that nutrition's, obviously the poor nutrition's causing us to be overweight and obese, causing diabetes and thus disrupting our endocrine function, but we're literally have sort of these pollutants in our food in the form of microplastics that are, everything, especially that's packaged, comes in plastic these days. You almost can't get away with it. Very rarely you have like bottled milk and glass anymore, right? And particularly when it comes to foods that are like drinks or foods that are acidic, it literally eats away at the plastics and it becomes part of your food and you're literally consuming it. So people might have recalled maybe like a decade ago, there was a whole controversy around one of these chemicals called BPA, which was actually found to be an endocrine disruptor. It basically functions as what's called xenoestrogen or a synthetic estrogen. It mimics the estrogen molecule in your body. And for men, when they're consuming all these sort of synthetic estrogens, it disrupts your endocrine system. It can be sort of feminizing. And so they banned BPA, for instance, in Nalgene bottles. It used to be in the lining of cans, like the little quad that's so popular in startups, and any sort of canned foods. The problem is there's lots of other chemicals like BPS, for instance, very similar sort of chemical that has not been banned. So it's not like they've gotten rid of all these plastics in the food, in the packaging that we consume. They've just kind of replaced it with stuff that's quite frankly not legal yet. But ironically, if you look at places like Europe, is illegal. So essentially we have a very unregulated, I call it big food industry, in which really their priority is cutting costs and making it taste delicious so that you're addicted to it. They're not designing it in a way that's optimal for your health. And they quite frankly don't care that they're polluting your body. And so we have this onslaught essentially of these endocrine disrupting chemicals. It's in our water, it's in our food, it's in our clothing because of how, so much synthetic fabrics that we use, or the dyes that are used in our clothing. Anything that's flame or fire retardant, including our carpets and our mattresses, are all sprayed with chemicals. Now, for good reason, you don't want your mattress to light on fire in the middle of the night, but you're also sleeping on it, rubbing it all over your skin. The skin is the largest organ of the body. It actually does absorb chemicals. And Teflon and the non-stick coating that's ubiquitous in our cookware is being cooked up. It goes into your food and then you're ingesting it. So it's not just the terrible Cheetos that we're consuming, but it's all the pollutants that come with that in our food and water that is having a drastic impact on it. And one of the reasons we suspect that to be true is it's not just affecting humans, but it's affecting literally our dogs and our pets as well. Dog sperm count has also decreased over time. And they're obviously eating a lot of ultra processed foods in the form of dog foods that we're providing. So that suggests to us that it's not just a human phenomenon, it's literally an environmental phenomenon that because of all this like fake food, quite frankly, that we're consuming, it's really messing up our hormone production.
Do people still drink milk?
Well, maybe not if you're in LA because it's fallen out of favor. But
I feel like they drink almond milk. It's a fake milk. That's not almond milk. That's a bunch of chemicals mixed together.
There's a lot of these alternative milks that I think, unfortunately, there's been a lot of propaganda saying that milk is unhealthy. But the question is, as a scientist, the question is not healthy versus unhealthy. It's healthy relative to what? What's the trade-off, right? Now, if you're swapping out milk, and milk may have some of its own issues, perhaps in the terms of like the hormones that it has. But if you compare that to an ultra processed oat milk, which is water, canola oil, which is an oil that never existed in the last 50 years, we chemically extract it from a plant called rapeseed. We've rebranded it canola because that wasn't, as nice sounding.
Doesn't sound good for the marketing teams. Like, yeah, we got to change this.
And then we put a bunch of sugar in it and a bunch of gelatin and other things to improve the mouthfeel. And then we're like, oh, this is a healthier and environmentally, superior alternative. But it's just marketing propaganda. God bless the Oatly folks for, convincing people that's the case. But that's kind of the scam. And I feel, as a psychologist, this is the unfortunate thing that you see. A lot of very empathic, well-meaning, in fact, intelligent people fall for this propaganda, and they think that eggs ruin your cholesterol, red meat causes cancer, milk is terrible for you. When the reality is, if you look at your parents and your grandparents who still have high testosterone, they were eating those basic unprocessed foods. And unprocessed foods, even if they're not perfect, maybe not pasture raised, grass fed, et cetera, those are always superior if you can get those. But even on relatively unprocessed foods, whole eggs are always going to be a superior choice than something that has 12 ingredients, came out of a factory with a bunch of chemical sounding names that you've never heard of. So people can have these dietary debates. What's the best diets, low fat versus low carb? Look, as a behavioral psychologist, I always say there's two things. The best diet's the one that you can stick to long term. So you should pick the one that you're willing to do and able to do forever. But number two, I don't think there's any disagreement that ultra processed foods are terrible for us, despite whatever macro of choice is your preferred sort of villain. And that we have to sort of return to a cleaner, essentially, diet, not only for optimal health, but making sure that our hormones are optimal as well.
Yeah. So we've identified that obviously processed food and sugar isn't good for you. Eat whole food. Okay. So let's say, you want to be optimal and you go down the checklist. It's like, okay, no processed food. So we're not going to Wendy's or, for my West Coast people, Jack in the Box. And okay, so none of that, no sugar, no ice cream, none of that. We're eating whole foods. We're eating, grass-fed meats, grass-fed ribeyes, free-range chickens. Okay, now what? Obviously, most people aren't going to go on a search to find, organic clothing, and then especially with mattress, right? So it's like, okay, we'll kind of deal with that, but at least we can cut out the food source of being unhealthy. So we have that. Now, this might be this era. What is the optimal testosterone? Let's talk about testosterone. The optimal range that you can naturally get there by just cutting out the dog shit and maybe implementing no test boosters, just by cutting out the bad stuff and then eating a healthy, more healthy whole food diet. Like, what's the optimal range you can get to? And obviously this might depend on what you're predisposed in childhood and your genetics and stuff. So
that's a great question. And look, I always say perfect is the enemy of good. The goal of this is not to freak people out and make them OCPD perfectionists that they feel like they need to be hippie granola crunching folks that can't touch anything synthetic, right? We're not. What the goal is to minimize the largest impact. So if there's a couple tips that I would say that you can prioritize in terms of reducing sort of the hormone onslaught. Number one, it's drink filtered water. A lot of the microplastics are actually coming in the form of more than of water in food. So the best thing you can do, bottled water is garbage. Don't drink bottled water. Make sure you're drinking filtered water. And there's levels of filtration, right? Even a Brita filter is probably better than anything. Reverse osmosis, I would say, is sort of gold standard in terms of filtration. But that will reduce the endocrine disrupting load, a significant bit. So that's the first.
That's from the plastic, right?
Yeah, it's from the.
So if you're buying. So if you're literally buying gallons of water, that's worse for you than putting a reverse osmosis filtration system in your fridge.
Right. Or unless the water that you're buying has been filtered, right?
Right. So what if you buy filtered water at like a store or Whole Foods and it is reverse osmosis, but it's in a plastic container? Does that matter?
It's not optimal, but I would say, look, you got to be realistic, and like no one's going to have a 5-gallon glass jar. As long as it's been reverse osmosis filtered, it's certainly superior. So the container, you can manage. I do prefer glass and steel for, at least your personal water bottles. It's always a better choice than plastic. Try not to heat your stuff in plastic, your food. If you're microwaving or heating anything, make sure that you're using, glass, Pyrex, stainless steel, And your pans should not have a non-stick coating. You should generally be using cast iron or ceramic, right? Something where it's a natural surface. Like if you have cast iron, what's going to get into your food? Iron. And iron is generally fine in normal dosages. So those are probably the best two things you can do is just drink filtered water. Don't heat or carry your stuff in plastic, at least. Of course, some of your stuff, like you said, large bottles or some of your food is obviously going to come in a plastic container. You don't need to freak out about that. But it's the heat and the acidity that kind of seeps most of it into it that makes the biggest difference. And then, yeah, obviously, if you're frying something or cooking something at high heat, you don't want chemicals in that process. That, and the last thing is just don't touch receipts. There's receipts actually have a very high amount of BPA, and there's studies that show that literally if you just touch a receipt, it absorbs into your skin and can be measured within minutes into your bloodstream. So refuse receipts. Yeah, you can actually look this up. Receipts are actually one of the biggest sources of BPA contamination. So that's a very easy tip, is just don't touch receipts as much as you can. And that will reduce your endocrine load quite a bit. There was actually a doctor colleague of mine, Dr. Yusuf, who did an experiment that he tried doing some of the tips that I mentioned, measured his hormones before and after, and actually did find at least an N of 1 is a significant improvement in terms of their hormone function. So what all of that will do is that at least it'll improve your testosterone to where your genetic potential should have been, right? Now, we can't eliminate all of it. We can't go back to the 1950s where, they're delivering milk in a glass jar, as I was saying. There really wasn't unprocessed food. We were cooking at home every day. Your mom made liver once a week. We can't go back to a bygone era. We have to obviously live in reality, and we have to be practical, and we're not going to be touching everything with gloves. That's not what we're promoting here.
I don't know. Some of our listeners are pretty hardcore. We walk out with an astronaut suit.
I mean, I really do try not to touch receipts, but other than that, I don't think anything else is like too unreasonable of what I'm saying. The reality, though, is you're still going to be getting a significant amount of these xenoestrogens or synthetic estrogens. So that's why, to me, I'm like, you have to fight fire with fire. And if it's a pharmacological problem, then it's fair to use pharmacology to fix it as well. And so I became really interested in this topic of, okay, well, what can we do on the pharmacological side besides changing our behaviors? But there's still going to be some pollutants that are still there to help do it. And here's the interesting thing that I found. There's no good solution for increasing testosterone to date. So on the one hand, you have testosterone supplements, right? You'll see these sort of T boosters at GNC. If you actually look at the research literature, and there's been reviews that have been done, they don't do anything. They don't increase testosterone. There's very little published studies on them. And if there is a published study with certain ingredients like tongkat-ali or ashwagandha, they make a very minimal improvement. You'll see them sometimes in studies increase testosterone by like 14, 15%, which sounds good, but in the clinical reality, 15% is meaningless, right? The difference between, for instance, someone who gets 7 versus 8 hours of sleep is about 15%. And that's how much you might even vary on a day-to-day basis, depending on your stress level or your sleep. You're not going to feel a 15% difference. I generally consider the bar for what's a clinically meaningful improvement 50%, 50. You're not going to feel the difference or feel back to where you should have been or feel like your father was unless your levels are high. And that's a sad thing when you ask this question about, well, what should testosterone levels be? The reference range for testosterone keeps going down in terms of what's normal. Why? Because the testosterone levels keep declining. So for instance, back in the day, the top of the reference range, meaning the 97.5th percentile, used to be about 1100, right? Their total testosterone, meaning like if you were like a quote unquote alpha male, you were at 1100 nanograms per deciliter. That keeps shifting down. Now it's about 900. We're saying, so what's happening there? Is it that's low or high? It's just that everyone's getting fatter and more polluted. And so what is average has been declining over time. That's why I actually think the best comparison is, you kind of like the whole theme of your show, is take people who are as healthy as possible and use them as the reference range. Rather than, if you're a 50-year-old dude, I don't think you should compare yourself to 50-year-olds, because the average 50-year-old is obese and has high risk of prediabetes. The best comparison group, in my opinion, are 19 to 39-year-old healthy, non-obese males, right? Because that's the closest thing to what probably an optimal level of testosterone should be. And if you look at that population, the reference range is actually quite a big difference. So, for instance, if you look at total testosterone, the 50th percentile is about 700 for healthy, non-obese young male, and free testosterone is about 134. And so you can obviously test your testosterone levels and see if you're around there. I generally suggest that people be within one standard deviation of the mean, essentially. So I would say like 500 to 950 would be like a normal range that covers like the most of the spectrum of people. Same thing with free testosterone. You want to be somewhere between like 100 and up to like 190 would be a good target range. That's very different than the lab reference ranges that you're going to get if you go and get your tested on a doctor, because we're comparing you to optimal, not to the average fat American.
What's the because I was going to ask you this anyway, so now we'll just jump into this. What's the optimal, like the max level, like the maxed out 1 rep level of tests that you should have, whether that's pharmacological or natural, without to the point where side effects are like right at the brim, and then if you go like 100 more, now you're inducing, you know, an onslaught of tons of side effects, right? Like what is it? Is it 1,000? Is it 1,200? Is it 1,500?
So yeah, this is where it might be useful to distinguish between total and free testosterone that I mentioned. Mm-hmm. I consider free testosterone to be a much more useful marker because total testosterone is the total amount of testosterone that's floating around in your blood. Mm-hmm. Now, however, it's bound to 2 different proteins. One is called albumin, and the other one's called SHBG, or sex hormone binding globulin. Essentially, these are carrier proteins and make sure that testosterone can go to the right place in the body. But while it's bound to these proteins, it's not free to be able to bind to the androgen receptor and do what it needs to do. Now, albumin doesn't vary that much, but people's level of SHBG varies quite a bit, right? I'm low in SHBG. My SHBG is about a 15. And there's some good and bad with that. The bad is that it increases your risk of insulin resistance, which I know because my father has type 2 diabetes, so I'm at higher risk for diabetes. The good, it means that my testosterone is a lot more free to go around and be active. And so I don't need a lot of total testosterone because my free testosterone is high. On the other hand, you see guys that have very high total testosterone, could be even 1,000, but their SHBG is so high, it's all bound up and it's not very free. So that's why I think free is actually a much more useful marker. As part of our program, we do lab testing. We measure total testosterone, we measure SHBG, and you can essentially calculate the amount of testosterone that's free to go about its business and do what it needs to do. For instance, the 99th percentile, right? So 1 out of 100, the top 1 guy out of 100 guys will have a free testosterone of 266 picograms per milliliter. And I would say that's like pretty high. That's the highest someone would naturally be, like maybe a top level Olympic athlete or someone who's genetically blessed, if you will have that level. For that person, the ability to build muscle is going to be easier in terms of putting on lean mass without putting on body fat. They're probably going to be a pretty driven individual. Their mood's going to be pretty good. They're going to have a high libido and sex drive, have a high degree of confidence sort of naturally. And quite frankly, they're probably going to be a high performer, whether that's in sports or in sort of the business world. So that's kind of the reference range. Now, we always say, though, that the number doesn't tell the story, the complete story. The philosophy of our clinicians is you should treat symptoms, not numbers, because there may be someone whose genetic potential is that 266, right? But because of these endocrine disrupting chemicals, their lifestyle, they're smoking, they're doing whatever, it's down to like, let's say 222. Now that's still a high level. 222 is the 95th percentile, right? And so they're still kicking ass and better than 95% of people, but it's less than where they should have been. And they don't feel like they used to maybe when they were 21 or they were healthier. So you have to almost like compare people to where they should be, essentially based on their own genetic potential. Unfortunately, not everyone has sort of tested their testosterone when they were younger or maybe healthier, or maybe they never were healthy, unfortunately, in the first place. So that's why you kind of pay attention more to the symptoms, which is like what I was saying. How's your mood? How's your libido? How's your ability to put on muscle at the gym? How's your drive? How's your confidence? How's your focus? All of these things they're multifactorial. They're influenced by a lot of things, but testosterone is one of them. And so you can almost use sort of the symptoms as a way of making sure that, okay, I'm feeling my best. And if I alter my testosterone levels, am I feeling better? Am I feeling to where I need to be? We actually do find sometimes if you do pharmacological enhancement, sometimes it'll jack up people's levels even beyond sort of the the normal range, right? They don't necessarily feel better. This is a very American mentality of more is better. Maybe if you're a bodybuilder, that's true, but we're not trying to build bodybuilders. We're just trying to get people to high normal levels, at least where their genetic potential was, or maybe even beyond their genetic potential, at least in terms of getting them back to where their father or grandfather should have been. So to kind of now go back to the pharmacological, what can we do about it? Testosterone boosting supplements don't work. On the other hand, there is testosterone injections, or what's called testosterone replacement therapy.
We'll get to that. We'll get to that. There's a lot to unpack, because I know a lot of people are like, wait, hold on, and then we're just steamrolling. Cam has a lot of testosterone, so you guys have to be patient with me here. So okay, before we go into TRT and then what you guys do, because we're going to dive into that for sure, because that's very important. Do you think, now this is kind of like a not irrelevant question, but it's kind of out there, it's in left field. Do you think that in a completely different subject, and in psych, you'll have a better understanding than most people? Do you think that if men, now female, completely different story, but do you think if men had naturally high testosterone, let's just say we'll stick with the 900 range, even though there's total and free, but we'll just say they're utilizing their testosterone is at 900. Do you think that prescription medication like amphetamines, like Adderall and Ritalin and Vyvanse, do you think that would be as necessary if we had optimal levels of testosterone? Like, do you think, let's just say, I know we'll get into TRT, but if someone was like, okay, I want 900 for sure. When I go to sleep, when I wake up, whether I'm fasting, whether I'm eating Cheetos, doesn't matter. I'm going to stay at 900. Obviously, that's going to improve their focus. Obviously, there's a lot of side effects, but that's going to improve their focus. That's going to make them more confident. That's going to make them more driven. Do you think that if we were more like healthier as far as like test levels, then we wouldn't need to like induce these psychoactive, ADHD medications?
So yeah, that's a great question. And look, I'll give you my best speculation because we don't know, right? I can't give you sort of an evidence base, but I'll give you some rationale for why I think that may be true. If you are talking about increasing natural levels of testosterone up to 900, or let's just say 90th percentile, there is clinical evidence that can improve people's concentration and energy levels to be a lot better. Now, unfortunately, maybe this is like a helpful analogy. Let's imagine that you're building a fire, right? So you're putting fuel in the fire. That natural fuel is good diet, exercise, good sleep, and the right amount of hormones in order to have optimal energy production. That's the best way to have a sustainable, long-burning fire. Using prescription stimulant medication like Adderall, Vyvanse, etc., is like throwing lighter fluid onto the fire. It will increase the fire temporarily, but how long can you stand there pouring lighter fluid on it? You do it for a couple seconds, you do it to get the fire going, but it's not really a sustainable thing. Now, it's a different thing if someone has clinically diagnosed ADHD and they're not able, through lifestyle and other factors, have the sufficient sort of dopaminergic function in order to perform at an optimal level. That's a small contingent of society. And most people, unfortunately, don't get a proper neuropsychological examination to truly determine whether they have ADHD or not. They go see a clinician. Unfortunately, these telemedicine pill mills out there, all you have to say is, I can't focus. Well, why can't you focus? Is it because you have stress and anxiety, which creates a ADHD-like behavior, but it doesn't mean you have ADHD. Nobody can focus when they're stressed and anxious. Let's address that problem first. Or same thing, if you have low testosterone and you're not producing the requisite neurohormones in order to be able to focus, like pregnenolone, for instance, which is part of the steroidal cascade. Well, address that underlying issue first. Just throwing lighter fluid to have more energy is not great, because obviously you get a huge energy burst and then you get a crash, whether you're using caffeine or amphetamines, actually, right? They're kind of fake energy. And they're also dangerous drugs to play with, because we know they create dependence. We know they have withdrawal symptoms, right? Like literally even people who consume lots of coffee on the weekends, they get headaches because their body's withdrawing from the dependence on a external medication, or as external, even if it's legal, an external chemical substance. And so that's very different than testosterone. Testosterone increases energy levels, but it does it in a way that's a lot more natural, and it's not a stimulant, right? It's not operating through the dopamine or adrenaline sort of systems, which caffeine and Adderall do. And so it's throwing lighter fluid on your brain, so to speak, which will induce a state of hyperfocus, and then the crash that comes after. And so you're getting this constant up and down. While when your natural hormone function is high, it's a much more clean burning, natural wood burning, if you will, sort of energy. And I'll give you my personal experience. I cannot tolerate any stimulants. I'm a slow metabolizer of caffeine. If I have a cup of coffee, even right now at noon, I will not sleep till 3 a.m. Now, it will increase my energy for sure, but it increases my heart rate by 10 beats per minute. It increases my blood pressure. It makes me sweaty, anxious, and nervous. And I'm just like a jittery mess, right? Because I'm more sensitive to it. So it works, quote unquote, but it's terrible. It has a lot of side effects, and it's this constant up and down.
You don't drink tea or coffee or anything?
I don't do it at all, right? I'm too sensitive to it. And I've tried all kinds of different, stuff like that. But, other people obviously build a tolerance to it. They can do just fine with, 1 or 2 cups of coffee. While when I've optimized my natural testosterone levels, my energy levels are high, but it's not that speedy, stimulant-y feeling. It just feels natural. It feels good. I don't have that post-afternoon, like I need to take a nap after lunch feeling. It's just a much more sustainable kind of thing. So I don't think people, until their testosterone is back to where it should be, know what the feeling is. I guess the closest analogy is like, imagine you got like the best night of sleep ever, 8-9 hours. You didn't wake up with an alarm clock. Your mood is good. Your partner is happy. That's the kind of energy you could be feeling every day, rather than slamming the alarm clock, dragging yourself out of bed, forcing yourself to wake up with a stimulant, which is counterproductive.
Okay. Thank you for that. It makes a lot of sense. Let's go back to testosterone and TRT. But before we go into testosterone, you said before that taking these, GNC or vitamin shop supplements, test boosters like Tribulus or Fagogia agrestis or tongue cat owie, they don't really move the needle. They might here and there, but it's more anecdotal. It's not sufficient amount of scientifically backed evidence. Now, for me, I did DHEA for a while, and it definitely improved my test levels. I went from like 700 to like 850. Now, again, that's not that drastic, but if you're trying to be as optimal as possible, taking a supplement like DHEA, which is like a hormone replacement, non-prescription, over-the-counter type supplement, definitely made some type of effect if I wasn't on TRT or, what you're doing now. So what's your take on DHEA? What's your take on, I know you said that you don't like the other test boosters, so let's just stick to with DHEA. What's your take on that?
Yeah. So DHEA is actually a hormone. It's a precursor hormone, right? I mentioned the steroidal cascade. So it starts with cholesterol, right? When you consume cholesterol, like for instance, from eggs or shrimp, your body converts that into pregnenolone, progesterone, DHEA, it eventually turns into testosterone, estradiol. Now, here's the tricky thing. In men, DHEA, for the most part, doesn't increase testosterone. They've done lots of clinical trials. Now, it may have for you, or there may have been a confounding third-party factor. Maybe you improved your sleep. I don't know what kind of happened. Well, first of all, I would say the increase, as I mentioned, that you had from 700 to 850 is not very much. It's actually 21%. It doesn't meet sort of the bar of like that 50% increase that most people would feel. Second, I'm not sure it's really because of the DHEA, because like I said, in lots and lots of studies, what ends up happening with DHEA is it converts more to estradiol rather than testosterone in men. And so what I would be curious, if you look at your labs, I'd be curious to see if your estradiol went up. Because one of the things that you want to look at is what's called the T to E ratio. It's the ratio of testosterone to estradiol. So even if you got a 21% increase in your testosterone, did you also have your estrogen increase by 21%? And with men, you have to be very careful about how much you mess around with your estrogen. There's almost like a Goldilocks zone. You don't want it to be too high. You don't want it to be too low. While testosterone can vary a lot more freely, like guys can feel pretty good on pretty high levels, you don't want your estrogen levels to be necessarily high. So generally, it's not really recommended or very common practice actually to use DHEA as a test booster. A, because the evidence is not there, and more likely the body in men tends to convert it to estrogen.
Got it. Okay. Well, I haven't got gynecomastia yet, so
Yeah.
so
Good.
maybe my estrogen is not too high. Cool. So TRT, what you're doing, obviously, is a big subject. Now, let's just say naturally, I'm sitting. We'll go with the big
Yeah.
number. I know you said total and free again, but let's just say that you're sitting at 750 naturally. You're not taking any
Right.
test boosters. You live a healthy lifestyle. You're at 700 or 750. But like a lot of people on this show that want to be Bradley Cooper from Limitless, like, okay, cool, I'm 750, but what if I was at 1,000?
Right.
What does that person do? Should they do it? And what's the actual like increase? Like if you're sitting at 750 day to day, obviously it goes up and down versus you sitting at 1,000. Like, how do you actually feel? Are you smarter? Do you have better focus? Are you stronger? Like, what's the actual difference? And should someone actually get to that level? Is it worth it to jump on TRT to get to 1,000, or to get to try to get to 1,000? Do what you're doing with Maximus.
Yeah. First of all, we don't do TRT, just to make it super clear in case there's any confusion.
That's why Maximus and TRT is separate. Yeah.
And the reason we don't do it is because it's a very drastic solution. And I'll make sort of an analogy that one of our advisors made. I kind of explained earlier the difference between type 1 and type 2 diabetes, right? There are some people whose literally their testicles do not work, right? They have what's called primary hypogonadism. They have a testicular injury, they have testicular cancer. They cannot produce testosterone, which is where the word it comes from, the word from testes. In that case, it makes sense that you're going to say, my body, no matter what I try, cannot produce its own testosterone. I'm going to inject testosterone, and it's okay because I'm dependent on it because I can't really get it elsewhere. That's a tiny percentage of men, and there's something pretty drastically wrong when you've gotten to that point. For most men, they have what's called secondary hypogonadism, which is a lot more like type 2 diabetes, which is they're able to produce their own testosterone, but there's something that's messing with it. It's their obesity, the extra aromatase enzyme in their body fat, all these endocrine disrupting chemicals, a lack of sleep, an excess of stress. All these things are basically interfering with the mind-body connection in which their pituitary and hypothalamus should be producing hormones, luteinizing hormone, follicle stimulating hormone, that go to the testes and say, hey, produce more testosterone, right? So logically, the natural way of doing that would be to improve the mind-body connection and get your mind to produce more of the precursor hormones to stimulate your own sort of natural production. But TRT doesn't do that. What it does is when you inject it externally, the body's intelligent and it says, oh, I'm getting enough testosterone. I don't need to produce anymore. So your testicles literally shut down, they shrink, and you become infertile. And if you don't believe me, there's literally Google, there's a scientific paper that says testosterone is a male contraceptive. And unfortunately, a bunch of guys go on TRT, they didn't read the instructions very well. They go try to have kids later, and they're not able to because it's basically like a car battery being dead for a long time. And
you can't bring it back. I've talked to some hormone places.
Depending on how long you used it and how strong of a dosage that you used it, you can do something called a post-cycle therapy and re-stimulate it. But in my clinical observation experience, it never quite comes back to the same level. Now, maybe you're able to have kids, maybe it's harder to have kids. But in our experience, we actually have a bunch of ex-TRT users in our program. They often either need higher dosages, or maybe it doesn't increase as much as if someone's never touched TRT or steroids before. The more that you've messed with your own production in terms of suppressing it, whether they're using TRT or anabolic steroids, which actually function, by the way, in the same exact way. They both are essentially they're either testosterone or mimicking testosterone, and it shuts down your own production. The longer and harder you shut it down, literally your testes will atrophy. So it's not just like a chemical phenomenon, it's a physical phenomenon. Your testes will literally shrink. Because think about it, it's a factory of testosterone. You literally turn off the factory for like 10 years, the building starts like wearing down, everything starts falling apart. You can't just not run a car for 10 years and expect it to turn back online and drive like a Porsche. So that's the analogy that I make is, if you've done it for a little bit, sure, you could probably come back, but the longer and harder that you've essentially shut off the factory, it's harder to do. That's why TRT is generally considered a lifelong decision. Once you start injecting it, you basically have made a commitment that I'm going to inject myself for the rest of my life. And that's why our advisors believe no one under the age of 50 should really be doing it, or even anyone who wants to maintain their fertility. should not really be doing it because it is sort of this drastic solution. In my opinion, and the opinion of a lot of clinicians, despite the fact that, yes, you get the testosterone boosting properties, if you can still produce your own testosterone, you shouldn't go rely on an external source of it because you're essentially hooked on it for the rest of your life. Which means, for instance, if you stop taking it, you needed to travel, you didn't want to bring it with you, or you forgot it, your testosterone levels will plummet and be way below normal because you've been dependent on this external source. So you're essentially reliant on it for the rest of your life. And there's pretty drastic side effects, which are, as I mentioned, your testicles will shrink and they'll become smaller. You'll be infertile for the most part. And also those neurohormones, right, that are the top of the cascade also shut down. You're shutting down something called GnRH, gonadotropin releasing hormone, which influences the production of DHEA, pregnenolone. Now you can try to backfill it and supplement, but you're messing with your body's natural cascade. And so it's never quite the same, essentially, when you're reliant on it. So
is it clomiphene?
Go ahead.
Is it clomiphene that, because before I forget, I want to touch on this because I've talked to hormone replacement clinics and people that do have these type of clinics, and I've asked them hard questions that, it's like, hey, listen, like if you get on TRT, what's the deal with fertility? What's the deal with this and that? So a couple of the TRT clinics that I've talked to, they said that they obviously give you like testosterone injections, but you also take, now correct, I don't know, I think it might be clomiphene. What's the chemical that people take that tells your brain to keep producing testosterone? What is it? Is that clomiphene?
It's clomiphene, or the brand name is Clomid.
Okay, so Clomid, right? So what a lot of these clinics are doing is you're taking exogenous TRT, but they're also doing Clomid or clomiphene, whatever. So their analogy is, yes, you are getting exogenous testosterone, but you're also not shutting off your own body just in case you run out or you can't afford it anymore or you go to France, whatever. What's your take on that, theory or mechanism of action?
Yeah, it's a good question. It's much more common to see TRT prescribed with something called HCG. HCG basically mimics LH, one of the precursor hormones that I mentioned that stimulates testosterone. Unfortunately, LH is now considered a biologic by the FDA and it's no longer able to be compounded. So most of these TRT clinics are not able to use HCG anymore. It's very rare what you're talking about in terms of prescribing TRT and Clomid together. It logically makes sense because if one shuts down your production, one stimulates their production, shouldn't it sort of like counteract each other? The problem is TRT is so strong, at least in the injectable or cream form of it, that Clomid can't undo the effects. So the clinics that are telling you that are probably misinformed, unless you're taking very low dosages of TRT, which that's not generally what they're doing. If you're taking a normal hormone replacement dose, Clomid will probably not counteract it enough. And so that sort of combination is not very commonly seen. Now, you can do what's called monotherapy, meaning just taking Clomid. And that actually is a good alternative to TRT for a number of reasons. Number one, it's a pill rather than an injection. So literally it's a much easier to do. Like nobody likes injecting themselves. It's a pain in the ass to have to inject yourself.
I don't know. I do NAD and glutathione every day. It's not bad.
You are a Bradley Cooper Windows kind of guy. I don't think the majority of consumers like injecting anything. You got to explain to your wife and girlfriend why you have it. I mean, biohackers.
My girl's a PA, so she understands.
It's much more normal. I think for most people, I don't think the majority of people are going to inject anything in themselves, to be honest, and for good reason.
I was surprised how many people are like scared of little insulin 30 gauge needles. It's like you don't even feel it. I do it myself.
Yeah. Well, the other thing is like it's not necessarily like a fear. Like I'm a healthcare practitioner. I get blood draws all the time. I have no fear of needles. It's just not preferential to do if you can obviously have an oral alternative. So anyway, Clomid's an oral pill. Here's the problem with Clomid.
What about the liver though? Because the reason why I like injections is it goes right into your bloodstream, or if it's intramuscular, I don't like taking any type of, because Clomid is it's harder than taking a vitamin C supplement, right? I don't like that stress on the organs. Wouldn't you rather just inject it so it bypasses any organ stress?
It depends on the compound. Oral steroids are harsh on the liver. That's why TRT and steroids are generally injectable. That's due to its sort of unique biochemical properties. Clomid doesn't stress the liver, actually. It doesn't elevate
Okay.
liver enzymes. And so it depends on the drug. Some drugs are harsher on the liver because of how they're metabolized. Some of them are not. So it depends on the compound. Obviously, there's a lot of like oral supplements that have great bioavailability, not harsh on the liver, may in fact even be liver protecting. So not necessarily. And also just think about it too, just from like a Lindy perspective, most of the nutrients that we're getting are through the mouth. Like it's never been, quite frankly, normal to inject yourself with anything. Now, there's obviously a time and place. You have an infection, you need an IV antibiotic to save your life. 100% inject me. But on like a routine use basis, if there's an alternative, I generally think it's better. So the problem with Clomid is actually two drugs. It's not one drug. There's two isomers, but which are mirror molecules, just like my left and my right hand. One is Enclomiphene, which is basically an estrogen agonist. It basically functions as an estrogen in your body. The other is Enclomiphene. And Enclomiphene is an estrogen antagonist, meaning it blocks the estrogen receptor. And this is the part that's responsible for actually increasing your testosterone. It's 62% Enclomiphene, 38% Enclomiphene. Now, here's the problem. When you start taking it, guys do feel better on Clomid, boost their testosterone due to the Enclomiphene. But Enclomiphene is a short half-life. It's about 10.5 hours. The half-life of Enclomiphene is weeks. It lingers in your body for weeks. Even if you stop taking it, it still takes weeks to get out of your system. So what happens over the course of many months is you're getting these daily hits of Enclomiphene, but the Enclomiphene is building up more and more because it's not getting out of your system, right? The Enclomiphene that you took 3 weeks ago, still in your bloodstream. And then the one that you took 2 weeks ago, still in your bloodstream. The one that you're taking today is now in your bloodstream. So now you have 3 times as much Enclomiphene. And so what happens over time, there's very little Enclomiphene in your system, lots of Enclomiphene in your system, which is basically you're taking a testosterone booster with an estrogen, and the estrogen keeps building up more and more. So generally what happens is over the course of a couple months, guys don't feel good on Clomid. Their testosterone levels on lab tests, just like I was saying about the DHEA, is high, but so is their estrogen because of the effects of Clomid. But also you have this basically artificial estrogen in the form of Enclomiphene that's floating around. And so you typically hear anecdotally people talk about they're more emotional on Clomid. It kind of kills their libido. Sometimes a small percentage of people actually have ocular side effects in terms of messing with their vision or getting floaters because of this Enclomiphene isomer. And they've identified this, that they've even done this in rats. They do find that these are essentially 2 different drugs with literally opposite effects. So unfortunately, I think Clomid is kind of a dirty drug is the way that I describe it. You have this great effective drug, but basically you're taking with an estrogen, as one of our advisors said. So a pharmaceutical company called Repros came along and was like, well, if this is the case, we need to purify it. So what they did is they removed the Enclomiphene isomer and said, let's just use the Enclomiphene isomer, which is an estrogen receptor antagonist. It basically blocks the estrogen receptor. And so even if you have estrogen floating around, or these synthetic estrogens, as we've been talking about, that are coming from these environmental pollutants, they're not able to bind to the receptor because Enclomiphene is blocking it. And so what that does is it tells the body, oh, I'm not getting enough estrogen. How do I get more estrogen? I need to produce more of my own testosterone. So unlike TRT, which shuts down LH and FSH, which is responsible for boosting testosterone and sperm, you see an increase in LH and FSH. It's actually, Clomid is a fertility drug. It's FDA approved for fertility in women. It's used off-label in fertility for men. So not only does it increase LH, which increases your testosterone, it increases FSH, which increases your sperm count and improves your fertility. So in a lot of ways, it's actually funny because even though they both, Clomid and TRT, increase testosterone, they do it in completely the opposite way. TRT shuts down your testicles, shrinks them, and makes you infertile. And Enclomiphene, there's actually published research that shows that it actually makes your testicles larger, increases testicular size and volume, increases sperm count because it's derived from a fertility drug. And so it actually enhances your fertility, and it increases testosterone quite a bit. In studies, it increases testosterone somewhere between 1.5 to 2.5x, depending on obviously the dosage that you're taking. We found, especially because we work with healthier, younger folks, you don't actually need that much Enclomiphene. We use oftentimes half of the dosage that was recommended in the clinical trial, 6.25 milligrams. And for, like I said, healthy, young, non-obese men like me, that's all I take, 6.25. And it has a dramatic improvement. So my testosterone levels usually about 450 to 500 in terms of total testosterone. not bad, but a little bit below average, as I mentioned, if like most guys should be floating around 700. My levels increased to 800, 900. And then my free testosterone, more importantly, increases from about 100 to 200. And so now that's in that kind of 95th percentile range. And it's dramatically.
So I want to talk about Maximus, right? So I think you kind of already went into what you guys do, but I want to make it clear on exactly what you guys do. Okay. Yeah. So with Maximus, what is the mechanism of action? We've identified that TRT is not good unless there's a very, very rare scenario in where you need the actual exogenous TRT. Okay.
Right.
And then also taking Enclomiphene isn't good because of the different variables. You could feel great here, but then, it's counterintuitive. And with every amazing feeling, there's always a trade-off because we're not made to feel super amazing, right? So when we start messing with pharmacology, there's going to be some side effects. So, okay, we've identified TRT, Clom, all that is not ideal or optimal, and you are not a fan of. So what does Maximus specifically do? Like, what's the mechanism of action? What are the chemicals that you guys are using? And take us through that route, and then we can talk on why someone should do it, why someone shouldn't do it. If someone is naturally high, should they, to get 200 or 300 extra points, is it even worth spending the $150 or $200 for the month subscription of Maximus? I think for a lot of people it is. Like, even if you can increase 100, our listeners and myself would definitely spend $200 a month because we have a problem. We want to be optimal, but maybe for someone it's not. Like, again, back to that question: if I'm at 700 versus 1,000, what are the actual differences in the way I feel? Because 700 is still relatively good versus 1,000. Like, what's the difference in the way you feel? So those questions, and then also, is it safe to say if you have giant testicles that you have naturally high testosterone? Like if you have big orangutan testicles?
Could be. That's actually a good question. I should look up if someone's ever actually done that study, and poor research analysts that had to sit there and do that. Well, we know that, like I said, if you stimulate the testes to produce more testosterone, and in terms of LH and FSH, if you have more LH and FSH that stimulates the testes, I should say, it'll make your testicles bigger and increase testosterone. So they tend to go hand in hand, and we know that Enclomiphene, for instance, do that. What are the actual effects of it? So there's been a published study that shows that it improves your ability to put on lean body mass. So in about 12 weeks on a higher dosage of this medication, because they're doing this for study purposes, people put on about 5 pounds of lean body mass. So if you're familiar with weightlifting, it's pretty hard. At least if you're an intermediate or advanced lifter, you've passed your newbie gains, as they like to say. You're not putting on a lot of muscle mass, maybe a half a pound a month, maybe a pound a month. Even if that's a lot, right? You put on 12 pounds in a year. Most people don't put on more than a couple pounds of muscle, even in a year. The people are putting on 5 pounds in a month. So it'll improve your body's responsiveness to strength training, which is, it's essentially a performance enhancing drug. And the reason I say this is because professional athletes cannot take it. It's banned by WADA unless you have a therapeutic use exemption, meaning like you have a doctor's no and you have a clinical justification for taking it. But doubling your testosterone levels, which is the average effect, will increase your muscle mass and increase your sports performance. And so there's studies that specifically show statistically significant improvements in lean body mass and sports performance. Other improvements that people see are in libido. So if you ask people, do you have a normal libido? Like, are you satisfied with your libido levels, right? And if you are in the lower testosterone hypogonadal range, people see pretty dramatic improvements. 28% goes up to 68%. Fine improvements in libido. In terms of energy, it goes from 35% to 60%. In terms of life enjoyment, like, are you satisfied with your life? Only 15% of people who have low testosterone enjoy their life. Goes up to 60%. What about their mood? Are they sad or grumpy? That goes from 40% to 70%. And then last thing I mentioned is sports performance. How's your performance in terms of your sports? That it goes from 45% being normal up to 75%. So these are all statistically significant improvements. And they're pretty drastic, like the life enjoyment going from 15 to 60%. That's a 4x increase. So it's pretty meaningful in terms of that. We've done our own research in our patient population as well. And we look at all these variables as well. We find that most people do interestingly find mood improvements first and foremost. As a psychologist, I'm interested in depression and anxiety. We obviously don't bill it as a treatment for depression or anxiety. You obviously need to do psychotherapy and other evidence-based treatments. But one of the ancillary benefits, I would say, is we see improvements in depression and anxiety, which is really interesting because, like I said, it influences the mind and body. When you ask about sort of virility, and by virility, I mean energy, strength, sex drive, even work performance, 74% of people see an improvement in at least one of those factors. And then finally, you talk about health behaviors. It improves people's ability to improve their diet, exercise, sleep, focus, and relationships. Why is that? Well, when your energy is better and your mood's better, you're more likely to do the right thing. So what is the Maximus protocol? It's really three things. I told you about the benefits, but how do you get those benefits? One, we send you a at-home lab test to start with, so we know what your baseline level's in. On this, pretty soon thereafter, you'll get prescription medication from a physician if they approve and they decide that they're right for the program, which is Enclomiphene, which is, like I said, it's that cleaner version of Clomid that removes the isomer that causes the side effects. And all you have left is the part that boosts testosterone. In fact, there's been head-to-head studies comparing Enclomiphene to TRT cream. And in obese men, it actually improves testosterone even more. So I always think, why inject yourself with testosterone with all the side effects of testosterone if you have a new drug that works just as well, if not better, in certain populations or in certain comparisons? We found on average, it works just as well as TRT, but without all the side effects. The second thing we do is we provide people with lipid-soluble vitamins or fat-soluble vitamins. The reason for that is, as I mentioned, supplements don't increase TRT, but a lot of people are deficient in, for instance, vitamin D. And vitamin D is absolutely critical for 200 plus functions in the body. We actually did a study here in LA. There's lots of sunshine here. 66% of men were actually deficient in vitamin D. 100% were below optimal levels, which is below 30 and 50 nanograms per deciliter. And that may impair testosterone production. So like I said, taking vitamin D on its own is probably not going to boost your testosterone. But if you're deficient, it may suppress your levels of testosterone. And there's a couple of fat-soluble vitamins. They all work hand in hand. Vitamins A, D, E, and K are all fat-soluble, and they're critical for hormone production. So we give people high doses of these within the upper tolerable range to make sure that there's no underlying nutritional deficiency that may be suppressing their levels if that's what's causing it. And then the third thing we do, and this is why we call it the King protocol, we're not just prescribing a drug. I never wanted to start a pill mill where we throw medication at people and pretend that the magic pill is the answer for everything, is we do health coaching, and that comes from Omada. Because, for instance, sleep is really critical for testosterone production. The difference between someone who gets 4 hours of sleep and someone who gets 8 hours of sleep is twice as much testosterone. Every hour that you improve from 4 to 8 hours is a 10 to 15% increase in testosterone. So one of the easiest things we can do in order to improve testosterone and help people feel better is get people to as close to 8 hours of sleep as possible. Now, there's some coaching that needs to be involved with that. If they have insomnia, if they have bedtime procrastination and they're on Reddit, whatever it is that they're dealing with, we use evidence-based behavioral techniques to help them do that, in addition to improving their diet, their exercise, and their sleep. How do we do that? We put people into an online accountability group. You're in a group with other people who are in the program, and they're working on themselves. I wrote an 80-page book on health behaviors that talk about what is the optimal diet for maximizing testosterone. How do you improve your focus? How do you improve your sleep? And what I found is most guys, especially if they're, in this kind of class, they're educated, they're professionals, guys like you who, you have a PA girlfriend, you're already doing some biohacking, you know the right things to do. I don't need to lecture you about exercise. It's that you're super busy and life gets in the way. And we know that social accountability, a little bit of healthy competition is really important for getting people to stick to their exercise routine. For instance, we know, people who do exercise alone versus with a workout buddy or a class, they're much more likely to stick with it long-term. So we essentially use that social dynamics to get people to do the right things in terms of their diet, exercise, sleep, and focus. And that's holistically part of the program. And so when we see on average people doubling their testosterone levels, is it because they have Enclomiphene? Is it because we fix their vitamin D deficiency? Is it because we fix their sleep? Well, it's all of the above. And then that way, I think really, if you want to provide responsible healthcare, you really got to treat people holistically, biologically, behaviorally, and psychologically as well, in order to your point, feel optimal. And that's really our philosophy at Maximus is I really don't believe in the sick care system where you only go if you have a problem. We don't just treat low testosterone and secondary hypogonadism. Sure, if you really have low T, we can do that too. But to your point, maybe you're a 500, maybe you're a 700, but you just want to look, feel, and perform better. There is a relatively safe way to do it now. And like I said, like I literally don't sell anything that I'm not willing to take myself. There's not research behind, and can't be done by a healthy, essentially, person. So all of our protocols are essentially a lot more into the performance optimization realm. I wouldn't call it biohacking, because I think sometimes biohacking is a little excessive. I'm not trying to live to 180 or do weird shit. We don't do any injectables. We don't sell any controlled substances. We're not doing wacky stuff. It's evidence-based, simple medication, simple protocols, and quite frankly, a lot of common sense in terms of like sleep stuff. But we have really good ways of getting people to improve in order to look, feel, and perform their best.
Got you. Okay. So is there any drawbacks to taking Maximus and all the different mechanisms that you guys are putting into the formula? What's the most common like side effects and drawbacks? And then also, let's say somebody goes to Australia or whatever, they go to Japan and they can't bring it with them for whatever reason. Now, if you're not taking Maximus, is it similar to TRT where your levels go in the shitter, or did they just go back to normal?
Exactly. They just go back to normal. And that's one of the huge benefits, zero dependence, right? Because it's stimulating your natural production. As I mentioned, it's like putting more wood into the fire. If you put a couple extra logs in the fire and then those fires sort of burn out because you stop taking the medication, the fire will just go back to where it was before. So let's say you're a 400 on Maximus, you go to 800. You stop taking it because you forgot to take your medications with you. By the way, you can travel with prescription medications if it's in your name. Stocks are prescribed anywhere in the world. So we have a lot of actually entrepreneurs and investors on our protocol. They travel all over the US and the world. They're able to take their medications with them because they have a legitimate doctor prescribed prescription. But if they just forget to take it, your 800 will go back to a 400. And you don't have like withdrawal symptoms. It's not like Adderall, for instance, where, there's a crash that happens. People generally feel fine. They're not going to feel as optimal as they did before, but that's fine. It's just like taking vitamin D. This is a really interesting common misconception. People are like, do I have to take it forever? And I'm like, no, you don't have to take anything forever, but like, it's the same thing. If you take vitamin D pills, it'll boost your levels. If you stop taking it, it'll go back to normal. There's no medication that gives you a permanent effect ever. Like, unless you're talking about curing an infection with an antibiotic. That's just not how any medication works. Now, to your question, what about side effects? This is a really good question. Every medication or even supplement has the potential for side effects. We're very clear about this. You can go on maximistribe.com/science and we cite the studies. The question is, how bad are they relative to other medications? The publications and the clinical trials basically say the drug that we use, Enclomiphene, is generally well tolerated, and the side effects occur relatively rarely. Generally speaking, they occur in between 1 to 3.3% of patients. The most common side effect was headache. That occurred in 3.3% of patients. The least common side effect that was noted was dizziness in about 1% of patients. So relatively rare. We're talking about 1 to 3%.
That's short term, though. What's the long? Is there any studies on long term?
Like people have
20, 30 years
for up to about 3 years, and they haven't found any adverse effects that resulted in them having to drop out. As I mentioned, Clomid itself has been prescribed since 1976 in probably tens, if not hundreds of thousands of patients. And so, I haven't seen any major issues there. As I mentioned, Enclomiphene is sort of the cleaner version, so it actually has less side effects. But Enclomiphene, like I said, 1 to 3% of people. But here's the interesting thing. When they compared it to placebo, right, because in a clinical trial, you have to compare it to a sugar pill, the side effects were actually not significantly different than placebo. So even if you give people a sugar pill, 1% of people will also develop dizziness, 3% of people also develop headaches. So it wasn't actually worse. So it's not even clear that the side effects are necessarily due to the effects of Enclomiphene. And so in the relative scheme of things, I would say, like I said, always there's a potential for side effects, but it's a relatively clean drug and the incidence of side effects are relatively rare. And so the other thing that just to say on side effects, it's something we obviously monitor really carefully, but because we actually have 8 different dosages of Enclomiphene. We're using dosages that sometimes are a half to even a fourth of the dosages that are used in the clinical trials. So occasionally we do have folks who maybe sometimes they'll take a higher dose, they start running into some side effects, we'll titrate the dose down. And our philosophy is you want to use the minimal viable dose or the minimum effective dose that gives people the nice testosterone boosts and the benefits in energy, libido, drive, confidence with minimizing the side effects. And this is why I always tell people more is not better. You want the best benefit with the minimal cost possible. And that's why we personalize it. We don't, like every telemedicine company out there that gives you Viagra, for instance, throws you a 25 milligram pill, even though you may weigh more than I do. I may need it more than you do, but it's not real personalization. The future of medicine, in my opinion, whether it's enclomiphene or any other drug, is people have very different pharmacokinetics. As I mentioned, like I'm really sensitive to caffeine. Well, you can probably drink a couple cups of tea, no problem. And so knowing
like
that,
13.
amazing.
Okay.
Like I wish I had that talent. And so that's the thing that we find really interesting is literally we can have guys who are taking 8 times as much as the other guy, both doing quite well. And that's the beauty of our bodies, right? And so side effects can be managed if we monitor. And that's the good thing. Like the reason we charge $150 a month, and it's for an ongoing relationship with the doctor. And sometimes people ask, like, well, why do I need to pay so much? I just like, give me the fucking meds and get out of here.
Yeah. That's not that much.
It's not responsible medicine. As in you have a PA, in your life. The proper way, obviously, is you got to monitor people and see how they're doing, how they're changing. Do they need adjustments over time? And our goal is to really find the right dosage. So what we do is we lab test people. We test them again after 30 days because the clinical literature shows the testosterone peaks around day 28. You can feel it within a day to a week, I would say, in terms of the subjective effects. Testosterone will continue to go up over time from week 1 to about week 4. And so that's why we test after a month. And then for most people, that's enough, and people see, like I said, a 1.5 to 2.5x increase. If they're not getting as much of an increase or they want to feel it more, we can adjust
the more
dosages. Or same thing, we actually take people down a lot of the time. And for some people, it may take 2-3 sort of adjustments to get them to the right amount. And then once they do, they're stable, they're good, and they can take it safely and effectively, basically forever, as long as they're continuing to get benefit and the doctor thinks, they're managing well, not experiencing any major side effects.
With taking something that makes you stimulate your testes to produce more testosterone, is there any chance or any thought on that increasing like testicular cancer? Because I've heard from going small to large in the past is if your testicles are changing in size at a rapid rate, that's definitely something that you should get checked out. Is that something one of your guys' concerns or?
Yeah, just to make it clear, when I say an enhancement in testicular volume, this is, by the way, only on the highest dose of enclomiphene. The dosages that we're using are not going to like meaningfully, like for most people, unless you're taking the higher dose, like huge. We're not talking about like doubling your testicular size. There's no evidence of testicular cancer with enclomiphene or even Clomid that I'm aware of. So
got it. Okay.
I think the better way of putting it, like I don't want to make people think like, oh, you're going to have giant balls by taking clomiphene. the real benefit for most people is that it's going to maintain your testicular volume, right? Which is it'll be the same, if not slightly bigger, if you're taking a higher dose. While on TRT, your testicles will visibly shrink, right? And so what we're really trying to do is just avoid that and just try to keep what you got. I think for most people are just happy to keep what they got. We're not trying to go for visual or aesthetic enhancement here.
No, for sure. So to get to, let's say 900 to 1,000, right? So is that just a normal dose? Is that relatively high? Obviously, it depends on where you're at.
Yeah.
Okay,
it does depend on baseline. Here's what we found in our clinical experience. Healthier people have a greater general response to medication, right? Like if you're healthy, you have a good lifestyle, you work out, your biochemical processes are generally functioning pretty well. And so you often need less, right? Like I mentioned, I only take 6.25 milligrams personally because I'm relatively healthy. I'm super fit, work out 5 times a week. I have low body fat, I have a 6-pack. I don't need very much. And so even on that lower dose, I get a 2x increase, right? In terms of testosterone. I actually had a recent patient who had a 3.38x increase, 3.4 basically on the same dosage. So even had a even higher increase on that. And that's the interesting thing. There's just a little bit of individual variability. There's some other folks, maybe they only get a 1.5x increase. We don't know until we try, really, right? I think it'll be awesome when we have a large enough data set that we can actually start doing predictive analytics and say, based on your age, weight, ethnicity, and all these other factors, we can almost predict your treatment response and we can know upfront what the dosage is. Right now, we have to play a little bit more trial and error and say, most people do fine on 6.25. We put them on that low. I always put people, by the way, on a low and conservative dose I am meaning our company, because like I said, we always want to minimize side effects. We can always increase you over time if you need to, but I never want people to run into side effects and be like, oh, I don't feel good and this isn't good for me, right? I think that's responsible medicine. So for most people, 6.25 gets about a 2x increase with, let's say, plus or minus 1.5. So between 1.5 and 2.5x. Some people do need a little bit more, but yeah, basically the healthier you are and the higher you're starting, usually the greater the response. But we're not usually jacking people up into like way high super physiological levels. Like I said, generally there's a misconception in that guys only generally, if they've ever measured their testosterone, they've only measured their total. They don't measure their SHBG. And one of the things we find is a lot of people have basically artificially high testosterone. What I mean by that is their total's high. They're a 700, as you said. So you look at your 700 or even your 900 and you're like, oh, I have high testosterone. But you're not looking at your SHBG. It's bound up. It's not bioavailable. So if you look at their free testosterone, it's actually average or even below normal. What the body does, it's very clever, is if you have high SHBG, your body compensates by producing more total testosterone because it's not sort of being filtered into free testosterone. While when you get guys like me who are low SHBG, the body's like, I don't need to produce a lot of total testosterone because your free is high. So that's why I'm saying you can have guys who are at 500 and guys who are at 1,000 in terms of total testosterone. They have the same free testosterone because they have very different SHBG levels. That's why I think it's really important to measure both and don't think, oh, just because my total's high, I'm actually really good, because it's the free that's a better predictor of, for instance, like the ability to put on muscle and feel the benefits.
And Maximus increases free, not just total.
Increases both. Yeah.
Okay.
Enclomiphene can increase SHBG a little bit on higher dosages, but even when we find that, it's still increasing both quite a bit. Most people actually don't necessarily even get a pretty an increase in SHBG because of the lower dosages that we're using. So yeah, generally you see both rise up. We also see estradiol rise up, which makes sense. Anytime, like I said, you increase testosterone, you increase estrogen, but it's not a concern because, as I mentioned, the estrogen receptor is being blocked. So even though you have one, it's not really doing anything. So it's, one of our advisors actually thinks there's no point of measuring it really in our context because it's not really doing anything in the body. So to your point, you mentioned, for instance, gynecomastia. People ask like, well, if your estrogen goes up, are you going to develop more breast tissue? No, ironically, Clomid has actually been used to treat gynecomastia because it's a selective estrogen receptor modulator. And so in prepubertal boys who have gynecomastia, there's actually published papers that show that it's used for that purpose. We don't obviously treat that here, but it's not a concern. We've never seen it ever happen. People also commonly ask about other side effects, which is like, well, if my testosterone goes up, is my hair going to fall out? Is it going to grow my prostate, right? Those are the two issues of male aging. And here's the really interesting thing. When you look at TRT increases both testosterone and DHT. DHT is a derivative of testosterone. It's kind of the virility hormone. It's the androgenic hormone that's responsible for like your beard, your body hair, the deepness of your voice. It's kind of like the masculine. One of our advisors calls it the aggression hormone. And so it's involved with libido as well. In some people who have a genetic predisposition to androgenic alopecia or male pattern hair loss, obviously there's DHT blockers like finasteride, which reduce the amount of DHT, and it may slow down hair loss. On the other hand, there's a percentage of people who develop sexual side effects in addition to when they take finasteride. TRT increases both T and DHT, and it actually increases DHT a lot, especially if you're taking the topical form of TRT, which is rubbed on the scrotum. It may be that putting it right there, it stimulates DHT production. We find, based on the research literature, testosterone and DHT in our protocol go up concomitantly, meaning the ratio of DHT to T does not increase. And so relative to TRT, it's much more hair and prostate friendly in that it's not jacking up your DHT levels. And so it shouldn't cause your hair to fall out or develop any sort of like benign prostate enlargement if you already even have that. And we haven't had any complaints about that to date.
Okay. So prostate and hair, relatively safe as of now.
Right.
Got it. Okay, cool. What's the neurological effects of having higher levels of free and total testosterone?
Yeah, it's really interesting. And this is kind of like gets into a really like emerging field that I think we're learning more about called neuroendocrinology, right?
Mhm.
I'm a professor of psychiatry, and generally the mainstay of treatment for bread and butter, if you will, depression and anxiety is to increase serotonin, right? Selective serotonin reuptake inhibitors or SSRIs, people might have heard of Prozac, things like that, block, just like enclomiphene blocks the estrogen receptor, blocks the reuptake of serotonin, increases serotonin. And so that's been one way of obviously improving mood. But I think we've come more and more to a conclusion that like serotonin is not just the happiness molecule, and it's not as simple as increasing serotonin. We found that like hormones such as testosterone do have these neurological effects, as you mentioned. And so there is a wide range of effects. Some of it we know anecdotally, interestingly, when you turn off testosterone. So, for instance, there are some folks who have sort of severe prostate cancer, and one of the treatments for it is these androgen blocking drugs that literally shut off your testosterone. If you're really interested, there's a New York Times article, it was published back in the 90s. They interviewed a guy who basically was like, what is it like to have no testosterone? And he reported really interesting effects. He was like, all of my motivation and drive just sort of disappeared. And I felt like I was just like living in a flat society. I had flat affect. Like I didn't care about anything versus when your testosterone is high, you care. The other thing is like motivation seems to be tied to testosterone. One way I like to describe it is testosterone makes effort feel good. Like when you're doing hard work, when your testosterone low, it feels effortful. It feels like a grind. It feels painful. Versus when testosterone high, it's like instead of a threat, it's a challenge. You're like, yeah, bring it on. I like the hard. Like this is interesting. Like it's not boring. And so you have a more of a tendency to what's called approach versus avoid difficulty, which is obviously critical to succeeding in a very competitive society. Like a lot of the work that we do is very, very hard. So there has a motivational enhancement effect. And then there's an increase in risk taking, interestingly, which may be good or bad, I guess, if you're a stock trader or not, and the type of trading that we do want to do. There's associational research that shows that, for instance, stock traders that have higher testosterone take more risks. Like I said, you can interpret that for what you will, but I think maybe in an entrepreneurial kind of environment, the desire to take more risk, I would argue, directionally is a good thing in getting people to not be as afraid of taking risk. And I think it makes people, the reason it does that, it probably makes people more confident. One last thing I'll say, there's an unfortunate mythology that testosterone is going to make you aggressive and a jackass. It's not true. A lot of that is based on steroid users who jack their testosterone levels or abusing TRT to levels that are like 3,000 to 5,000. It's not normal.
They're using Trenbolone. They're not. They're using the real stuff. The stuff that's made for horses.
Interestingly, when they've done TRT studies where they get people to normal levels of testosterone, people actually become friendlier, which is interesting, right? Not more aggressive. They're actually friendlier, calmer, better mood. And it kind of makes sense anecdotally if you think about it, because if you think about like a naturally high testosterone guy, like a warm father figure is probably the best description. It's a strong and silent man. It's someone who's like secure in their masculinity. They don't need to mouth off. They don't need to like prove anything by like get into a fight at the bar. Those are low testosterone men, in my opinion. And they're overcompensating by like trying to prove. So this is like short man syndrome, right? That's the short guy at the bar who's starting all the fights. It's not the jack 300-pound dude because he's like, I don't need anything to prove. I look good. I feel good. My masculinity, my testosterone is good. So I actually encourage people to think about it that way. It shouldn't be associated with like aggression or douchebaggery, all these bad things. Generally, when people find security, whether psychologically or physiologically, they actually tend to be a lot more chill because they're like, I'm good and I don't need to go out of my way to prove it.
Gotcha. Okay. So for drive and motivation, risk taking, confidence, increasing your testosterone is going to be drastically a big part of your life and make your work. Let's just focus on just, financially, your work is going to have some type of increase because of all those factors, but not really like critical thing. It doesn't actually like make you smarter, make your neurons work better, fire faster. It just puts you in the place to, okay, now we're going to work and I'm motivated, but it isn't actually like, you're not going to learn Mandarin Chinese faster if you have high testosterone.
I wish. So I'll tell you an interesting thing. There was a study, I believe it was done in Turkey, of medical students, and it looked at their intelligence, their IQ on IQ tests, and testosterone, and they did find an association, meaning people who had higher IQs had higher testosterone. Now, that's associational. It doesn't mean it caused it. It doesn't mean that increasing testosterone is going to make you smarter, but it tends to go hand in hand, which is interesting. Now, what causes what, we don't know. I certainly am not going to make the claim that it increases intelligence, but it's interesting that it goes hand in hand. And so a better way of putting it is this. I think testosterone, if you had to pick one marker that basically is like the best marker of male health, overall health, I would actually pick testosterone. Because if you're doing everything right, your body fat's good, your diet, your exercise, your sleep, your relationships even, right? Having regular, intercourse improves your hormone, like lifting heavy weights improves hormone. Being in an environment where it's competition is good, increases testosterone. All of these things lead to higher levels of testosterone, and it's a good marker for overall health. And obviously, if you're overall healthy, you're probably more likely to be intelligent. You're probably more likely to do better at work. So I think it's a good thing to track. And if I had to pick one way of getting as close to Bradley Cooper and Limitless as possible, I would argue it's not modafinil, it's not Adderall. It would be testosterone. I think optimal natural levels of testosterone is as close to achieving at least your physiological limit of achievement as possible. And obviously you need to tie that in with all the psychological and behavioral stuff. The great thing that you obviously promote on your podcast in talking to top performers, is you have to have the right processes in place and the right habits and behaviors to be successful, right? I have a private practice. I work exclusively with top tech CEOs, VCs, and professional athletes. These guys are on another level. A lot of them do have naturally high testosterone. Some of them are using the Maximus protocol as well, but they're also like, they work ridiculously hard. So it's here's the way that I put it. Testosterone is a cheat code, but you need to have the right blueprint to make sure that you execute on it.
Now we have to deem out some bro science. Does ejaculating lower your test levels? Because I've heard fighters, right? Fighters won't have sex. For females, actually, they want to have more sex for whatever reason. And I kind of have an idea of why that's the case. But for men, it used to be Floyd Mayweather. And I remember watching Kimbo Slice when he was alive. He would say that he wouldn't masturbate or he wouldn't have sex for months leading up to a fight. And then I heard that from Jake Paul recently too. So
yeah, there's a lot of mythology around this. There is some research that shows that testosterone and growth hormone may go up acutely when you don't ejaculate. It goes up for a couple days, and then afterwards it kind of goes back down. So it's not a stable or reliable effect, first of all. So I think this whole no-fap kind of movement is a little misguided. The real problem is actually
like schedule it though. Should you schedule it like every 3 days? You should ejaculate. Like if you wanted to do like systematically.
I don't think so. I don't think honestly. Here's the thing. Sexual activity and orgasms tends to be healthy in men, right? We know it like improves prostate function, for instance. So I think all this weird like anti-orgasm stuff is misguided. You should ideally have a healthy sex life. I think that's a pretty reasonable thing to say from a psychological and physiological perspective. There's better ways of enhancing your testosterone rather than trying to abstain from activity. I've looked into this issue because I work with professional athletes. The main issue actually about abstinence is you don't want to be engaging in heavy activity right before a game. And that's like heavy sex, right? So that's actually the reason it's interfering is one, it keeps people up late at night, which interferes with their sleep. And second, if you're exhausting yourself before a game by having, a super physical sex, that's the problem. If you probably sat there, got a blowjob and went to sleep early, it would probably be fine. Right. So that's the thing. Okay. You got to be scientific about it and be like, what's actually the problem? It's really the sleep and the physical activity. Orgasm is not evil. The real problem that most guys have is they have an addiction to pornography or they're excessively masturbating. And that has all kinds of psychological issues above and beyond the hormone function. So as long as you're reasonable about the amount,
you're not jerking off 6 times a day. Got it.
Yeah, that's problematic.
A lot of guys just turned the podcast off.
Exactly. But honestly, if it's like once a day and it's especially like meaningful sex with a long-term partner that enhances the intimacy of your relationship, clearly beneficial. That's what you should
Do you think if
striving.
you took like blood work and you tested your test and you didn't masturbate or you didn't ejaculate for 5 days and then you ejaculate and then take a blood test immediately, you don't think there would be any change if everything was the
Uh,
same?
it probably, like exercise, would actually cause an acute spike in testosterone and growth hormone and then go down, right?
Hmm.
So you'd see it. So it depends on, this is the problem. That's why I don't think it's a good idea to do. Like, when would you measure it? 5 minutes after, 30 minutes after? Because 5 minutes, I would actually predict maybe a higher level, 30 minutes, maybe lower. There's natural fluctuations. So it's the same thing. You win, you watch your winning sports team, like if you're a Rams fan, win the Super Bowl, your testosterone levels go up. If you're a Bengals fan, they go down. Is it meaningful in terms of how it impacts your life? Not really. I encourage people not to stress about acute changes in testosterone. Focus on long-term average levels, which are going to be dictated by your lifestyle and your pharmacology.
Who are some of the investors in Maximus? I know you have a handful of big names, just so people can, identify who's putting their money where their mouth is.
Yeah, and like the reason we even like talk about this though is because when you're in an early stage startup, people are like, okay, like, are you legit?
Hmm.
So first of all, before we talk about the advisors, the thing I'm most proud of is the clinical advisory team. I'm a medical school professor. I brought on 6 other of the top urologists, literally the guys who run the urology fellowship programs, the top medical schools, University of Utah, the guy who literally wrote the textbook on testosterone over at Tulane University, one of the top private practitioners in the country, Eugene Shippen, who also wrote one of the testosterone textbooks and is a legend in the field, practicing for 50 years. You have the best of the best, in my opinion, in terms of medical school professors, urologists, and private practitioners who focus on sports regenerative medicine and hormone optimization, who are developing our clinical protocol. So even though I am a fan of Enclomiphene, those guys know it better than me. That's actually their specialty. And they're the guys who are doing all the medicine and determining our protocols. So that's the thing I'm proud of the most. And then obviously we have great investors as well. Keith Rabois, who's a legend at Founders Fund, involved in the founding of PayPal, Open Door, Square, LinkedIn, PayPal, is phenomenal billionaire investor. Joe Lonsdale is also a billionaire who founded Palantir and runs AVC. There are 2 lead investors. And then we have a lot of amazing angel investors. Dave Asprey from Bulletproof, who's the father of biohacking, Ryan Holiday, who runs Daily Stoic, Brian Lee, who founded The Honest Company with Jessica Alba, and the key executives and founders of Coinbase, Tinder, and Shopify are some of our investors. So it's honestly a privilege to work with them. They've started some of the biggest consumer companies in the world. And I think the reason they invested is not because of the testosterone angle. I think it was honestly because of the bigger mission of the company. All of these guys realize that there's a crisis of masculinity, and it's really important for us as a society to celebrate healthy masculinity. I really believe that masculinity and femininity in their mature psychological forms are positive healing forces of society. That's why I think about the company as a movement. We promoted a hashtag. It's called Tonic Masculinity. You can check it out on Twitter. And it's videos of guys being courageous, generous, magnanimous. It's Kobe Bryant being a great girl dad. It's a guy like saving a deer on a frozen lake. It's like, how do you use your testosterone for good? I always say, look, if I double your testosterone, you go act like a douchebag. We haven't done any good in the world in terms of the company. The real purpose of the company is to increase and optimize testosterone to where it should have been in the first place that your father had, and then use psychology and social support to get you to channel it in a way that's positive, that's pro-social, and it's productive, that's good for you, it's good for your family, it's good for your colleagues, and it's good for society. That's what healthy masculinity is about. That's what Maximus is about. And that's why I get up every day and I want to run this company for the next 20 years, is because obviously as a psychologist, that's my bigger mission, is I want to give people the energy to go and thrive as human beings and make our world a better place.
When did you guys start?
We started in 2020, so about 2 years ago. Raised $5 million from those investors. We've been running since we launched about 6 months ago, and been growing pretty rapidly. We're available in 13 states. We started out in California and Florida. So you can go on our website and check us out, maximustribe.com, to see if we're available in your area, and hopefully we'll be all across the country soon.
For sure. When I was doing research for this interview, I just want to ask real quick before we end this thing, are you still doing dopamine fasting?
Yeah. So I became, it's a funny thing you mentioned, I became famous for popularizing that protocol, and it went kind of viral around the world. Yeah, and it's actually part of our Maximus protocol. People always talk about diet, exercise, and sleep, but I think focus is the most underrated health behavior, because without focus, you're not going to have the time and energy to do your diet, exercise, and sleep. In fact, there was a study that basically was done on dopamine fasting. They had college students give up Facebook for 2 weeks. They found that they saved 13 hours a week of time. So almost 2 hours a day they had free. And what did they do when they had all that free time? Started cooking, started working out, started taking care of themselves. So dopamine fasting, if you can check it out, if you just type in my name, Cameron Sepah, dopamine fasting is a evidence-based protocol. It's based on CBT, or cognitive behavioral therapy, that helps people overcome addictions to behaviors. The key one being obviously internet addiction, social media addiction, pornography addiction, right. That all of us, quite frankly, are addicted to. And it's not saying you need to be abstinent. You can't get away from the internet, right? You have friends, you got to use it for work. So how do we moderate it? Just like we moderate alcohol use, if you're not going to be completely abstinent, in a way that it doesn't control your life and it doesn't take over your energy and your attention. And your attention is the most valuable resource that you can have. And all these companies are stealing it and profiting off of it by serving you ads. And so you really want to be careful about where you put your attention if you care about being a high performing individual.
Are you guys running ads?
We are running ads.
Cam.
For sure. I mean, obviously, my justification, I'm obviously biased.
I'm just kidding.
No, it's a good point.
It works. It works.
Here's the thing. I would love for us to be 100% organic. That's why I go on these podcasts, is because to me, I would much rather go and educate people by talking to your audience and get them to the program that way than giving Facebook more money.
I know.
So
I'm just giving you shit.
So let's wean off the ad cycle. But for now, it's a necessary evil, and hopefully it's justified in the sense that, look, like, we have people pay for a product, right? We're not stealing their attention. We're hopefully giving their attention back and improving their attention. So yeah, if I get you to watch a 60-second clip explaining what Enclomiphene is in order to get your attention, hopefully you can forgive me and feel like it's justified.
Absolutely. Cam, it was an honor to have you on the show. We had a great conversation. I think a lot of people can extract what we talked about and implement it into their life, have a better quality of life. I know I'm definitely interested in talking to you about Maximus after this conversation. How do people get in contact with you? Let's say they want to be a patient. They just want to learn more about it. What's the best way?
Check out our website, maximistribe.com. We call it Maximus Tribe because we have a community of over 1,000 men. That's part of our program and protocol. And that part of it, by the way, is free. So even if you don't want to be on the pharmaceutical drugs, I think it's honestly a good public service that you don't have to do work on personal improvement alone. You can join the community. It's discord.maximistribe.com. We obviously host it there. And if you just want to work on yourself, we have a tribe of guys who are willing to help you out and provide you social support and accountability to do so. So I just think that's a good public service for the world, and you can feel free to do that, communicate it on there. I have a weekly call-in radio show. It's every Thursday at 6 o'clock. We have it on all the social platforms. You can find me at Dr. Cam Maximus on Twitter, Instagram, etc. And I respond to basically every single question I ever get. So if you ever have any questions, just whether it's about hormone optimization or just trying to be a better man, you're dealing with relationship stuff, whatever, we have people call in on the show. I work them through their problems, give them a little bit of coaching, and try to do good.
And I say this every show, but just to reiterate, all the links to Cam and his practice and Maximus and everything will be in the show description below. Cam, I love what you're doing. And yeah, well, that's basically it, guys. So check out my buddy Cam. He's doing great things. And this is the Justin Caviar Show. We're out. Bye-bye, y'all.